Good morning, everyone. Today we have a very honorable Dr. Venkatesh Babu from Sucha Eye Cure in Chennai. So today we are talking about cataract. What is cataract and what is the meaning of cataract? Because in these days there are lots of people they are suffering from cataract, but sometimes they don't know what is this. So please tell us, doctor, what is cataract?
First of all, good morning, ma'am. Giving me an opportunity. Many thanks. Now, cataract is basically we have a crystalline lens inside the eye,
Yeah.
which when it becomes opaque, loses its transparency, we call as a cataract. So, any lens which was once upon a time transparent,
Yes.
when it loses its transparency, we call this as a cataract.
So, sir, is there any impact come in our
It's generally cataracts are an age-related process. Although we see cataracts right from birth, childhood, and in the adult. Very common cause being an age-related process.
So, is it a genetic or a normal one?
Most of the cataracts are acquired, although we see a few genetic cases, infantile cataracts,
So,
congenital
so
cataracts.
lifestyle matters in cataract.
Yes, it matters. A person who has a diabetes which is not under control, people who have certain disease like asthma, who are on certain medications like steroids. So those are all things which will induce cataract, and the progression also is going to be fast.
So, what are the early sign of cataract or a symptom?
Yes, blurring of vision. Sometimes you have a glaring of lights, especially while driving at nights, and image doubling. So the normal day-to-day work gets affected with the cataract.
So, is it prevented or not?
Although age-related cataracts we can't prevent it, at least we can slow down the progression by keeping in mind all the associated general health conditions like good control of sugar, BP, cholesterol. Lifestyle modifications also play a role.
Definitely. So, which kind of precaution we can take? Precautions.
Precautions is like you have a pre-existing disease,
Okay.
keep it under control. Trauma is another important factor, especially during firecracker injuries. So those things we'll have to keep in mind.
So, how can people treat this?
See, cataract, the only solution is a surgical intervention.
Okay.
There are no non-surgical ways where we can remove the cataract. Now, the cataract surgery has become very technology driven, wherein it's going to be like takes around approximately 15 to 20 minutes of surgical time,
Okay.
and the resting period of a week to 10 days should be enough for the recovery point of view.
So, it's surgery is safe for us or not?
Almost like the success rate following cataract surgery is close to 95 to 99%.
99%.
Yes.
Okay. So, some people think that after the surgery, cataract will come again. So, is it true?
No, that's a myth. Once we remove the cataract, we don't get a recurrence of cataract. We have something called as after cataract, wherein we place an intraocular lens over the support of a capsule called posterior capsule. Over a period of time, for some people, there is thickening of the posterior capsule. So, in a layman, we call this a second cataract.
Okay. So there is a lots of myth about also
Yes.
cataract. Like some people think that when cataract is cooked all, so then they will go for a checkup or for operation.
So those are days like where we used to wait for the cataract to mature because
Yeah,
the
mature.
technology was not that much developed. So nowadays, like once you feel your normal activity is getting affected, then we go for an intervention. And nowadays, cataract surgeries have become more like a refractive surgery rather than a vision restoring surgery. So following cataract surgery, most of the time we try to prevent usage of glasses post surgery.
Earlier people thought that that's why I asked you. So this is totally a myth.
Totally a myth, ma'am.
Okay. So, how can we take care of cataract if we have?
If at all, like probably once in a year, a periodical checkup. If at all we don't have a coexisting illness, In the presence of which the physician is going to advise the follow-up part of it. And once the normal lifestyle activity is getting affected, we'll have to take an opinion and seek a remedial measures for that.
Is it caused by a blindness or something else?
If untreated, yes, the drop in vision will keep progressing to a stage where the vision is markedly being reduced.
Thank you. Is there any other advice you want to give us about cataract, about take care of eyes, something?
General measures like injuries has to be kept in mind,
Yes,
and
yes.
keeping all the other lifestyle diseases under control. And once in a year, a periodical checkup once you cross 40 years.
Okay, so thank you so much for
Thank you,
coming
ma'am. Pleasure,
here
ma'am.
and giving us such a good advice for us. Thank you.
Thank you.